Again, I'm sorry. Okay. So thank you for alerting me to the sound. Okay. So I apologize for that. Let me start again by saying good afternoon and thank you for participating in today's training. Today's part 3 of a 3 training series. We started on Tuesday discussing the difference between direct messaging and secure messaging. Yesterday we went over the more information on the functionalities of direct message, and today we're going to be going over secure message functionality. And these trainings have been all concentrated on the new Greenway patient portal. As I mentioned, we're going to be going over a little bit of the definition, some of the setup. I don't go deep into the setup. Every practice, whenever they implement the new Greenway patient portal, they have their own setup training specific for their site. I just want to give you some pointers on what you need to look for. How to send invitations to patients to join the portal. What is the patient experience? Working task that request that the patient sent, and what do you see as an administrator on the portal? And I'm going to ask if everybody can hear me, and if somebody can just type it in the chat, yes or no, I'll appreciate it. Thank you. Okay, with that said, let's go into the training. And we start with what is secure messaging. Secure message is a secure electronic email to communicate with patients on their health information. Now, this is a communication that goes both ways. The provider can communicate with the patient can communicate with the provider. Think of it as an email. The only thing is that it's encrypted, it has more security, and it's especially for patients to share information, and that will be protected, PHI information. What can a patient ask through the portal or through secure messaging? They can ask for prescriptions, they can ask for non-scheduled, non-urgent appointments, they can update their insurance or update their demographic and contact information. How exactly does it work? Well, again, similar to direct message, the provider has a specific address, encrypted and proof after proof of identity. They're also using a certified EHR system. In our case, it's Intergy. And the documents that are generated also meet the standards for communication and exchange documents. So when a document is generated, different from direct message that is going to go outside, this document is not going to go outside of your server. It actually goes into the patient portal. And what the patient gets is a notification on their email. So on their personal email, what they get is a notification alerting them that there's something on the portal that they need to log in to view it. Once they log in, they're able to access that information. So again, nothing is leaving your server and your practice. There are many benefits to this communication, and hopefully as people become more and more aware and more familiar with this type of communication, it would help. For the patients, then you're able to communicate with your providers easier. You don't have the pressure of what time do I call or what are the office hours. You can just send a message to your provider with any questions. Some patients do feel more comfortable typing and sending messages to the patient than talking to some of their health concerns face to face. Also, maybe after they go to a visit, many of us forget to ask questions while we're at our doctor's visits. So if you remember any follow-up questions, you could always ask via secure message. and share any type of information if the doctor is helping you to maintain any health conditions. For the providers, it's also a great benefit. You avoid the issue of phone tag, having to call the patient, you can't get the patient and you have to keep trying. No, in this case, you send a secure message and you know that when the patient is able, they're going to log into the portal and find that message. They can address several different health concerns with their patients. Remember that it is a secure way of communication. And also very important, the information is captured in the system. No more trying to remember, did I call the patient, did I not call the patient, did I put a note in the system, I forgot to record that. No, the secure message is in the system, and if you are linking that message to a patient, it will stay in the patient's information. Another thing is support staff can triage the messages and alert the providers to anything that is urgent. I'm going to go again just to give you a brief overview of things that you need to look for in the setup. And the main ones is that you have the task set up in Intergy. These are all tasks that can be set up. It's up to your practice which ones you do set up and which ones you don't to make available for the patient in the portal. Just to give you an idea, a patient can update their demographics in their own portal, and then you will get a task letting you know that the patient updated their address, their phone number, whatever it could be. The user can also update their insurance information. Once they do that on the portal, you will get an insurance task. You will have to update that information, approve it, and then the patient will be able to see that update in their portal. If the patient just has a general question, they can also select the task called General Message. If they're requesting a specific medical records, you get that request. That's another task that gets set up. If it's a medical question, you have also the option to select it. Patient appointment requests, very popular. The patient can request what provider, what location, what times they want to schedule an appointment, and then your staff receives that task and it's able to find an appointment for the patient and reply right back to the patient. Then if your practice is also set up or decides to get set up for prescription refill request, the patient is going to have the option to select from a list of medicines that they've listed in their record. And if you're set up for electronic prescriptions, then you will get a request, an RXR request. If the patient decides to type the medication manually, the medication is not on the list, they're just sending you a request, they will select other, then you will receive it as an RXP request. External payment receive task is also another one of those exceptions. It depends if your practice is set up to receive payments online. This needs extra setup. But what you're going to do when you come to the task setup window, and that you do an Intergy setup menu task in order to access this window, is that the second piece that for the task that I just mentioned, you're going to go look for those tasks and make sure that you're routing that information and there is an assigned, first of all, that there is an assigned recipient. So this request, in this case, are being assigned to a pool. Like I mentioned, it could be, what does this mean? This is a patient appointment request. When a patient sends an appointment request, this group of people are going to receive it. If your practice is small and you only have one person, Anna Smith, responsible for working appointments for your patients, then that will be the name that you will display here. But you need to make sure that somebody is assigned to receive those tasks. The second thing that you need to make sure is in the routing piece is that the information is going to come linked to a provider. When the is sending a secure message from the portal is going to be linked to a provider. So you need to make sure that those tasks are being routed to someone that will be working those tasks on behalf of the provider. You don't want the provider to be concerning themselves with general questions or appointment requests or billing questions, things like that. So you want to make sure that those are routed. Different from monitoring, where the provider might be able to see their direct messages. Routing means is bypassing that first person, the intended recipient, and the text is going to go to the recipient, the alternate user that will be working those tasks. Now, important is maybe in this practice, there is a person responsible for working appointments requests. And that person is responsible for working appointments requests only for a particular location. So that's how you set up the routing. Then you have another person that is responsible for working the prescription refill request. You will come here, you will say no on the all types, you will search for that task, the RFP, and you would assign that particular task to route it. Now, if you're not familiar on task setup, I'll invite you to reach out to our Health Solutions team so we can schedule a training. This is just an overview of routing task. So those are two things that you need to look out for. Make sure that the tasks are set up, that there is an assigned user, and that the message to the provider are being routed. Now, as we go into secure message, we also want to remind you that we're trying to meet our meaningful use measures and objectives. And Objective 8 for Meaningful Use Stage 2 is patient electronic access. It has two measures. One of them is giving access to the patients to the portal in a timely fashion. And the measure number 2 is actually the patient actually going into their portal and viewing their information, downloading it, transmitting it to a third party if they need to. Third party could be a referral provider, another user themselves. So how do we do that? In order to meet measure 1, the first thing that you need to do to give patient access is send an invitation. I'm going to show you how to send an invitation from Intergy. When you go into Intergy, most of you are familiar with the patient information window. The patient comes in for an appointment, and now you're going to get your staff to start asking for email addresses. They're going to click on Edit so that they can get the edit window, and they're going to type the patient's email. Once they update the patient's email and they click Save, the email address is going to display on the patient information window. I want you to keep an eye on this field. Okay, so right now the email is displaying on the patient information, but you still have not sent the invitation. So what do you need to do now to send the invitation? The second part to send the invitation is now you're going to click on the same window. You're going to click on messaging. Here you're seeing the status as the patient has it right now. Access not granted because we have not sent the invitation. Once we click on send invitation here at the bottom of the window, the invitation goes to the patient, and you can see that the status changes to invited. So right now we have invited status. So that's how you're sending that invitation to that patient and you're meeting your measure. Now, this is what the patient actually sees when they log in into their own personal email, in this case, Gmail. Now, this is something new. This register button is from the last version of the Greenway patient. And now they're going to be able to, when they get this message, they just click this button to register. The next thing that they're going to get is this window to prove their identity. And important is that this information, the date of birth, the zip code, needs to match what you have in Intergy. Otherwise, the patient is not going to be able to register successfully. Once they're done, they're going to click Continue. So, if you remember, before the status was invited, now the status changes to registered. Another thing that I want to point out to you, which is very nice, is here in the personal information window, now you have a hyperlink. So what does that mean? That if you're in the patient information window and the patient is registered to the portal, this is what you're going to see. And the only thing you need to do is click that hyperlink to send any type of secure message to that patient. Isn't that nice? Now, Intergy has another way to send invitations to patients, and it's a mass invitation tool. So if you're not sending an invitation just one-on-one to one patient when they're registering per se, and you want to send invitations to a group of people, then what you need to do is you go into Intergy, the communications menu, and you click the portal invite utility. This is what the portal invitation utility window looks like. At that point, you're going to have a couple of different actions when you're sending and when you're getting ready to send the invitations. One of them is for those practices that are in the process of moving from the old portal to the new portal, they're going to be able to select if they want to send invitations to the patients that they had in the old portal by selecting patients using church scripts. The second part is they can select, am I sending invitations to patients that had a previous appointment, or am I sending invitations to patients that have future appointment? If you're thinking of meaningful use, you have to think of your reporting period. So in reality, you don't have to go 5 years back into appointments. You can just select the last 3 months or the appointments in the past for this year. So just something to keep in mind when selecting past or future appointment dates. How far back do you want to go? If your practice uses specific classes, a lot of practice use classes to categorize patients, sometimes for grants, sometimes they have it for self-paced. There's many uses for classes. So if your practice do use classes, this will be a way that you can just select the category of patients and send an invitation. If you don't want to send invitations to confidential patients, this is the place that you will exclude them. And if you want to include patients that were previously invited to the Greenway patient portal, if you remember when we were going through the statuses, when you send that invitation, the status changed to invited. So here it's asking you, do you want to send an invitation again to those patients that have a status as invited or not? So once you make the selections that you need, you can send those messages and those patients will get an invitation to join your portal. So now we're going to have, the second part of meaningful use is actually getting your patients to the portal. And how are we going to do that? I think the best way to do that is for you to become familiar with all the services that a patient can use and utilize in their portal. So we're going to go right now through the patient experience. What is it that they see when they join their portal, and what can they do from their account? Okay, we're going to go over the different sections in the My Health Record account. Another thing that I want to point out is that the patient can access the portal, but also there could be other people called users that can access the same account. So for example, if it's a child, the parent might be the one that is accessing the account. If it's a family, if it's a spouse, so whoever you want to give access to your account, they can also view that information. So when the patient joins the portal, and somehow this is acting a little bit out, okay? When they join the portal, this is what they're going to see. And the page is the same for everybody, for admin, for support, for patients, for any type of practice. This is myhealthrecord.com. It's going to default in the summary page in My Health Records. In this summary page, the patient is going to have an overview of all the information that they have on their chart, on their information. If they click the View option on the left-hand side, they can actually select how much of the history they're going to display. It's going to display here, 6 months, 1 month. Now, the next piece that I find very useful, and the way that I see this is a lot of times patients are calling the office because they need to go on to see the referring providers. Hey, I have a visit with my cardiologist and I need my records, I need to take them. Well, the only thing you have to tell your patient is, do you have an email? If you have an email, you can access your portal and you can print the records yourself, or you can email them to your provider. Now, not a lot of patients are savvy as to what a direct address is. This is only for those savvy patients. But let's say they get their email for the cardiologist's office. That's what they will be posting here. And they can send that information directly from the portal by clicking Send Health Record. They can also email it to themselves. So this is a very neat feature on the portal where they can send their own health records to themselves or other providers. The other thing that meets the requirements and that is actually very useful for them is the blue button. By clicking that blue button, they can actually download their information, and they can do it as a PDF file, which is more common for all of us, or as an XML, which is used for exchange documents. So those are two functionalities that they have right there on their summary page in the portal. This line here is going to tell the patient when was the last time that your account was updated. Now you have to keep in mind that for the information to be displayed, let's say they had an office visit, the provider needs to finish their notes and sign it before it could be displayed here. Or the staff, let's say if they're updating their insurance information, the staff needs to update it in Intergy before they can see it here. But if they do update it in Intergy, they will see here when was the last time that it was updated. Not only that, but in the last version, they added this refresh button so that the patients can manually request the latest records. And the last time I tested, this is from empirical research, it's done right away. Right away you'll see the last records. If they schedule an appointment, they come here, they refresh, they will see that appointment right here in the patient portal. The second part of the My Health Record is the visits. In the visits, they're going to have a list of all the times they've been at the doctor. And if they need to get more information on that particular visit, they will just select it, and the information will display for them. The next part is the medications. They're going to see a list of medications that you have in your Intergy chart. And if you set up the task for request medication refills, then they could come here and click Request Medication, and they can either select from a list that they have, or they can type a medication. This is a task that your staff will receive, and then they will need to work from the task menu. The next part is the patient education window. Now, every time when the patient comes to their visit and the provider prints the patient education, that link is saved under that note, and as soon as the provider signs that note, those are going to display here for the patient. So this is another way how you can entice your patients to come into the portal. Do you want me to print you the patient education, or you can also go into your portal and print it yourself or access it? Now, they can also come here and use this search feature to find information on whatever health needs they have. And they can do this in English or in Spanish. So again, this area, patient education, is another enticing point for your patients. The next part is the documents and forms. These are all the forms that you have made available for your patients in the portal. Depending on your setup, you can have them by different categories or just all listed as one. So this is depending on the setup that you created. The patients can complete forms, the patients can print their forms, whatever you make available to them in the portal. Finally, on this left-hand side menu, you have the access log. This is to let you know that everything is being recorded. All the activities that are happening in the patient portal are being recorded. Did the patient or another user, maybe the patient didn't, but another user that has access to their account downloaded information, they can see it here. How many times was this account viewed? When was the last time it was viewed? All of that, it gets saved into the access log. The next part on the patient information and the patient experience is messages. So when you're communicating with your patients and you send them a secure message, this is where they're going to see them. Same thing, if they're sending information to the practice, this is where they're going to see them. They're either going to click the inbox or they're going to click send, and they're going to display the list of messages that they've sent or received. From this very window, they can click new, so they can send that information to the practice. And here is where they will select the provider, their provider. They will type the message. They can actually attach files if they want to and send it. You will receive it in Intergy as a task. Next, we have the appointments section. And here, the patients can see all the appointments that they've had, their appointment history or their scheduled appointments, any information that they have. A very neat feature is that they also have the Google Maps right here. That is to help them locate your office. But this feature now, it's up to the practice. You could either turn it off or on if you want for the map to display in the portal or not. So this is a practice preference. The next thing that they're going to be able to do is, which again, this is a very good enticing feature for the patients, is you can request appointments via the portal. When they click here under appointments request, this toolbar is going to pop up for them. The only thing they're going to need to do is click new. And when they click new, they get the different options that they have for appointments. They can select a location. If your practice has several locations, you can select one. They can select their provider. How soon do you want to make that appointment? Again, this is not for urgent appointments. There has to be a time frame. What is your preference? Monday, Tuesday, Wednesday, whatever day of the week it is. Or if you have no preference, and the reason for your visit. When you're done entering this information, you submit this. And again, your staff will get a task under the task module for you to work and reply back to the patient. Finally, we have My Profile. in my profile, you have two sections. You have my information, where you have all the contact information and demographics for the patient, and where they can actually update their own information by clicking Edit. If they click Edit, the fields become available, and they will just need to type the information that they need to update. And when they click Submit, that's when your practice is going to get that demographic task. Now, they're not going to see the update here on their portal until someone in your practice updates it in Intergy. Once that information is updated in Intergy and saved, then they can come here and see their updates. The next piece here is in my profile is my insurance. Same thing as the demographics. If they click Edit, they will get the fields. They will update their policy number. This will be a good way for them to keep track of what information you have for insurances for them. Once they're done updating or adding information to the insurance, they're going to click Submit, and that's when you're going to get the insurance request. Finally, and this is really only for centers that want this set up for them, you're going to have the Pay My Bill option. This requires extra setup. So if your practice is interested in this piece of the system, I will encourage you to contact your account manager so that this could be set up, because you're going to need the outside vendor to process payments. Again, if you have this set up, you will get it as a payment request, as a payment task. And someone in your staff will need to process it and input it. But the functionality does exist. Okay, so now that you know the portal and you know everything that the patient can do, they can send their records to themselves or to other providers, they can download their own records, they can request appointments, they can request insurance updates. You want to make sure that your staff is encouraging patients to access the portal as much as possible. Anything that can be discussed via secure message, you have to get your staff to start using it. These are, again, some talking points as you start training your providers and your staff, anybody in your staff. Something that you do need to keep in mind is those messages need to be replied to. The patients need to know that you're following up on their request via the portal in order for them to continue using it. If you're not proactive, they're going to start and they'll go right back to the phone calls. So now, how do you send a secure message to a patient in the system? Well, I have the steps here, but we're going to go over the information. And you can do it from both, from Intergy or Intergy EHR. In Intergy, you will go to the task module and you will click New. In Intergy EHR, again, you will go to the task module and click the plus sign. Another way that you can send a secure message to a patient is directly from their patient account. As I mentioned to you before, if a patient is registered, you will see here secure message as a hyperlink. And then you can send the secure message straight from this window. If you're working from EHR, this is how you're going to see it. The hyperlink is going to be right there in my patient information. And the same thing, the only thing they need to do is click Send Secure Message Link, and they're able to communicate with the patient from this window. Now, regardless of how you start that secure message, the window is going to be the same. This is the window that is going to display for you. In this case, you're going to select View via Secure Message because you're sending it to a patient. Remember, patient communication, secure message, provider communication, direct message. The next thing that you're going to do is select the to item if you have not already. So if you start from the task module and you have not selected the patient, then you click the to line and click OK. If you started from the patient account, this information is going to be populated for you automatically. After you select the to, who is the intended recipient, you're going to type the subject line. Again, remember the subject line is not encrypted, so you should not put any type of PHI information in this line. That's something to remember, and again, they always put this note in there, so just don't bypass it. The next thing that you could do is you're going to complete the subject of the message, the body of the message here. You can type anything that you want here really for the patient, and something that we want to encourage you is to start using quick text. That will be a way that you can standardize your message, and your staff will always know what to write on those specific messages for medical records, for referrals, for demographics, for appointments. If you start creating your quick text for those specific secure messages, then that's all you will really need to use. The next part is you can also attach information for the patient. So if the patient is calling you to request some type of medical records or information, you will click select, and you will get the select attachments window. Again, by using the slide bar on the top, you can select how much information to display. Do you want 1 day, 1 week? If you know that they're only requesting the information for the appointment for last week, then you don't need to go all the way to all the documentation. From here, you're going to be able to select from the Exchange Documents section and from the Documents section. Now, if you have something on the computer that you need to attach, similar to an email, what you will click is click on File, access that document, and you can attach it as well. Regardless of what type of document you're attaching, you have a limit of 5 attachments. You cannot enter more than 5. And the system will tell you if you try to put more than that. Finally, when you're done with that message, you click Send. You can save that message to the patient chart for your records, and that message is sent out to the patient. Now, remember, that message doesn't go directly to the patient personal email. They get a notification that a message was sent to the portal, and they need to access the portal in order to see that message. So now that we were able to go over Objective 8, which is granting patients access to the portal, and the patient actually downloading and viewing their information, we go into Objective number 9, which is sending electronic messages to patients. So this is where you start replying to your patients. A tip that we gave you in the first training was to start encouraging your providers that when they're reviewing their labs, to start, they click review, not to click quick review. They should click review so that they can get this window to open for them. Okay, when they get this window to open for them, again, they're not going to see this window if they click quick review for lab results. They're only going to see it if they click review. Once they click review, they get this window, and they're going to select this option, send secure message to patient. Notes is for internal notes only, so nothing that you put in here is going to go to the patient. But when you click here, send secure message to patient, this is what's going to open up for the provider. In this case, you see that the patient's name is already populated, that a lab result from your healthcare provider subject line is auto-populated. And in the body of the message, you can type anything. Again, you can make use of the quick test. This will be a good way to make use of quick test, or they can type anything they want in the body of the message. Once they make sure that they have the information needed for the patient, that message gets sent to the patient. Okay? And if you remember when I went over the patient experience, the patient is going to receive that message here in their message section, and this is exactly the message that was sent when the provider was reviewing those labs. You see? So this is how it will display for the patient on their account. It's 2 clicks, and you get to meet your measure as to sending secure message to patients, sending communication to your patients. Now remember that the communication to patients needs to be of a clinical matter, lab results, medical questions, clinical questions, appointment requests, medical records requests, those do not count for the measures. The next thing that you're going to need to do is start replying to all the tasks and requests that the patients are sending to you via the portal. How are you going to do that? They all get worked from the task module. So regardless, you can work your task from Intergy, or you can work your task from Intergy EHR. What I must say is that the demographics, the insurance, the general messages, the medical records, all of those have to be worked from Intergy Desktop, not from Intergy EHR. Okay? The clinical ones get worked from Intergy EHR, or either or. You can view them in Intergy EHR, the medical requests and the demographics, but you cannot work those from here. Okay, this is a general message. I open this from Intergy Task. This is how it will display. You will start seeing the different groupings of tasks. General message task, appointment request task. You will highlight the task that you need to work, and you will click reply to patient. You can see here the reply to patient button. When you click that that button right here, you go back to the secure message window, and you follow the same steps that we previously discussed. Disregard what I typed in here. It was late. So in here again, use quick test. Make sure that your staff is sending appropriate replies, not what I typed in there, to your patients. The only difference when they get this message to populate is that they get here this option, complete task on send. So if by replying to the patient you're done with this task, then you can click here, complete task on send. If you still have to do something else with that task, you reply to the patient, yes, I will be sending you your medical records, and you still have to send the medical records, then do not click there, so that the task is going to remain on your task list, and you're going to be able to work it. Okay? This will remove the task from your list. Okay, so now that we've had the patient experience and you know how to send a secure message, which again, I think is very user-friendly in this new system, I just want to give you a brief overview of the admin side. So when you log in into myhealthrecord.com, as an administrator, these are the options that you're going to get. Again, I'm not going to go deep into each one of those options. I'm just going to give you an overview because this is an entire class in itself. And when you start implementing your patient portal, you're going to have to go through all of this one by one and make sure that it's set up correctly. In the Activity Center, you're going to be able to see the message that were generated, how many invitations were sent out, if patients register, any type of information that is going on in your portal. You're going to see it in the Activity Center. In the portal settings is where you're going to be able to set up your practice configurations, your providers that you can make appointments for, or not, locations, what appointment preferences you're going to make available for your patients, what color is going to be your page, any type of disclaimer or information. That's going to be your portal. Now, in portal accounts, you're going to see all the patients that have already registered to see the portal. In practice users, you're going to have your administrators, your staff, anybody in the practice that has access to this window. And under the documentations is this where you will set up all of those documents that you're going to make available for your patients for registration, for completing forms, for downloading forms. This is where you will be setting that up. So this is the Activity Center that as an administrator, that's where you will be working from. Now, a lot of the setup is also done in Intergy. And when working tasks, it's all going to happen in Intergy and Intergy EHR. So working requests will always stay in Intergy and Intergy EHR. You will not be receiving any type of request in here in this portal. The only tip that I'm going to give you is how to reset a patient's password. So it is very user-friendly and the patient can reset their own passwords. But if they're still having challenges, what will they do? You will just need to click on the portal accounts. You will search for that patient, the particular patient that you need to reset the account for. And you will click on Reset Password. And that's it. Isn't that easy? Once you click Reset Password, you will get a message that says a message with a link to reset the password has been sent to the user's email. The patient will get an email notification in their personal email, and they will have to reset their password from there. So this is a neat tool that you're going to have. Again, you're going to have to give access to your staff either to be able to do this. Okay, so that is our presentation for today. I will open the lines for questions, and while I do that, let me open the polls.